program, and here we go.
Good afternoon. I'm Marlene Childers, campus nurse at the University of Rio Grande. I normally am here with my host, Mike Thompson, but he's not here today, so we want to send him get well wishes quick. So I'm going to talk to you today about stress and later in the program about hepatitis A. So because we're in the last week of education here and finals week is coming up next week, I thought it would be very important to touch on stress and what it may do to our bodies. Because I'm sure as college students, and I certainly remember these days, this is a very stressful time. So stress is defined as the way we react physically and emotionally to a stimulus or a challenge. Stress is natural. It affects us physically, emotionally, and mentally. It can threaten your health if stress is unmanaged. And also, on the other hand, it can be used for growth. It is the opposite of relaxation. So how the body deals with stress, I have an attachment that I'd like to go over with you about what it does to our body. So if we can get that up here. Okay, so we're not able to bring that up, so I'll just go ahead and talk to you about what it does to our body. When you have a stressor, you start having racing thoughts and snap decisions. That means your decision making may be impaired. The pituitary actually stimulates adrenaline production, and so all senses are heightened to enable a quick response. Pupils dilate to let more visual light, visual acuity to let more light increase. You may have gritting teeth or clenching jaws. The sympathetic nervous system activates and increases alertness and awareness and strength. Red blood cells pump into the bloodstream. More oxygen reaches the brain to stimulate thinking. And you may have perspiration because of the increase in heat dissipation. Stored sugars and fat pump into the bloodstream to increase available energy, making a rapid pulse and increased breathing. Digestion stops. Blood diverts to the brain and muscles to prepare for the fight or flight. Blood clotting mechanisms activate to protect against injuries. Muscles tense in the arms and legs, and blood diverts from the extremities into the trunk and head to protect internal organs. Thus, the inability to sit still. So, it can affect our body in many different ways. Short-term stress is part of our daily life. We deal with little stressors every day. Chronic stress, however, is unrelieved pressure and aggravation day in and day out, thus making the body wear down and lowers our immune system to open host to infections and diseases. Also, chronic stress can lead to mental health problems that can occur. Your ability to manage chronic stress is critical to your well-being. You must identify the stressor that is impacting you. You can learn to master stress through diversion and distraction by changing your way of thinking, making lifestyle changes, or changing a situation. So I'm going to go over a few things here that will help you perhaps decrease your stress. As a college student, you're suffering typically from short-term stressors, such as your final exams coming up. So it's very important to take on some breathing exercises. So you take deep breaths in and out, allowing your body to slip into relaxation. So I'm going to demonstrate with each breath in. You're going to say, I am, and on each breath out, relaxed. Let's try it again. Deep breath in. I am, and deep breath out, relaxed. Again, in and out. I am relaxed. Okay, so deep breathing is very important. Changing your attitude or way of thinking. So what you want to do is try to separate your worries from concerns. So express gratitude for one new thing every day. Develop stress by busting thoughts to reassure yourself that you are thinking rational. And give yourself some positive reinforcement for those small accomplishments. So changing your attitude or thinking by separating your worries or concerns. Sometimes we worry about little simple things, and so try to work through those by reassuring yourself that you are thinking rational. For instance, instead of saying, I can't do this, say, I can do this. So give yourself some affirmations there. You want to change your lifestyle. So avoid the hassles to eliminate some of the daily minor irritations. So you want to develop support systems that that you're able to share your feelings with. So, you know, get your BFF or a family member and talk about, you know, what's stressing you, what's causing you to worry or, you know, be concerned. So utilize your support systems. That's a very positive way of dealing with stress. And develop a sense of control and a new habit of relaxation that works for you, perhaps. Whether that be exercise, deep breathing, talking to your support systems. And lastly, do something for the kid in you every day. So, you know, be good to yourself in every way that you can. Changing the situation is another way of tackling chronic stress. So prioritize to better manage your time and learn to say no. I have a problem with that sometimes, and so I'm trying to work on that because I add to a lot of my stress when I you know, take on more than what I should probably. I think a lot of times we're all guilty of that, so be aware of that. So I told you that chronic stress can also cause some mental health issues, And so the next items are when to talk to a professional counselor. When excuse me, when your chronic stress becomes a problem for your mental health. And so you want to talk to a professional counselor if you have mood swings or angry outbursts, prolonged crying, using drugs or alcohol to cope, reckless behavior, anxiety attacks or panic attacks, inconsistent work performance, interpersonal difficulties, having difficulties in your relationships, becoming withdrawn, having low energy or chronic fatigue, a change in sleep patterns, decreased or increased appetite, feelings of hopelessness or despair, or diminished pleasure. And lastly, suicidal thoughts. So all those are instances that you would need to seek professional help. Some physical symptoms that are associated with stress, and I went over some of these, but of course, this is the fight or flight syndrome. In any instance, you can have a rapid pulse, dry mouth, perspiration, nervous stomach, cramping, vomiting, nausea, diarrhea, indigestion, pounding heart or chest pains, shortness of breath, trembling hands, headaches, clenching jaw or grinding teeth, chills, increased susceptibility to cold weather, having cold hands or feet, a flushed face, hives, muscle pains or aches. So all those are symptoms along with hypertension. And I definitely see a lot of that when they come into health services, the clinic here on campus. They've had a rough day. Many employees come in and get their blood pressure taken, and you know, they say, I'm here because I feel my blood pressure's up, I've had a stressful day, and typically it is. So we practice at that time doing deep breathing and some relaxation techniques. And about 15 minutes after talking, I recheck their blood pressure and it's down. So I see that most frequently in stress disorders. Emotional symptoms of stress are nervousness, anxiety, depression, feeling hostile or easily angered. Boredom is another. Apathy, and that means you're just somewhat emotionless. You are without emotions. Moodiness. Feelings of failure or inadequacy. Irritability and being impatient. Feelings of powerlessness. Worries of fear, and intense emotional expression. So, ways to reduce stress is what I'm going to talk about now. And so one of the ways is to focus on one task at a time. Set limits when you need to. Allow extra time for tasks and appointments. Get help with the jobs you dislike. Set realistic expectations for yourself. Express your feelings. Schedule breaks in your day and add some fun. And again, practice deep breathing techniques. And most of all, laugh as often as you can. And so I tend to surround myself by people who humor me, so that helps with my stress. People that make me laugh or are joyful. So it, in turn, turns me around and helps me be joyful. So the next time you feel stressed, I want you to pause, put the pause button on, and change the state of mind that you're in. Sit down, take deep breaths in, deep breaths out. Give yourself affirmations that you are relaxed. In and out, deep breath. Move around, such as stretching, walking, or even yawning helps reduce tension. And best of all, take a break, focusing on the tension in your body. So those are all ways to deal with your short-term, everyday stress. Now, like I said, if it gets into chronic stress, then we're talking about, you need to seek medical attention for that, because, again, that can really cause some problems as far as your health goes. Now, for the next few minutes, I'm going to talk to you about hepatitis A, because there's been a concern of recent hepatitis A outbreak spreading throughout the tri-state area of Kentucky, West Virginia, and most recently in Ohio. Hepatitis A is a vaccine-preventable communicable disease of the liver caused by the hepatitis A virus. It's usually transmitted from person to person through the fecal-oral route or consumption of contaminated food or water. Hepatitis A is a self-limiting disease that does not result in chronic infection, such as in Hep B or Hep C. So Hep A is different from Hep B and C. Symptoms of hepatitis A typically take 15 to 50 days after exposure. Most adults with hepatitis A have symptoms of fatigue, decreased appetite, stomach pain, nausea, and jaundice that usually resolve within 2 months of infection. Here's the bad thing is most children who are less than 6 years of age do not have symptoms or have an unrecognized infection. So it's best to go ahead and get your children immunized for the Hep A while they are young. And they usually are the highest at risk to contact Hep A because of the fecal-oral route, and I'll talk more about that here shortly. Antibodies produced in response to hepatitis A infection last for life and protect against reinfection. Currently, there are now greater than 300 cases of known Hep A in Kentucky and over 20 reported cases in West Virginia and a few cases in Ohio as of this past week. And I obtained that information from CDC. This is what's somewhat concerning as it can spread rapidly. As said, Hep A is contracted from person to person through oral contact with fecal matter. It attacks the liver, and as I told you before, symptoms are abdominal pain, nausea, diarrhea, fever, and jaundice. And you get jaundice because it affects the liver. Transmission occurs most frequently among close contacts, especially in households and extended family settings. Common source outbreaks and sporadic cases can also occur from exposure to fecal contaminated food or water, which mostly has occurred, that's how it started in Kentucky. Uncooked foods also have been recognized as a source for outbreaks. Prevention is vaccination. Getting the hepatitis A vaccine will prevent you from getting the disease. You can get immunized at your local county health department. The cost for the vaccine at Gallia County Health Department is $81.34. If you have health insurance, they will bill your insurance company, and many insurance companies do cover the immunizations. If you do not have health insurance and cannot afford to pay for the immunization, they will provide it free to you, free of charge. If you have United Healthcare here through the University of Rio Grande, that immunization is covered 100%. It is no cost to you. And I might add that in 6 months you would need a booster. So one shot does not take care of this. You need to get a booster 6 months from the first shot that you're given. Hand sanitizer does not prevent the Hep A virus. You must use proper hand washing to keep from getting hepatitis A. So I had a video, but it's not going to come up, so I just am briefly going to go over some proper hand washing. So you think there is an art to hand washing. So you want to start by wetting your hands under clean, warm water, using soap to lather the back of your hands and your palms between your fingers while singing happy birthday twice. And that adds up to about 20 seconds. Rinse your hands well under clean, warm water by pointing them downward. You never want to just rinse. You want to rinse like this so that the water runs downward, and then you're going to grab a paper towel or hand towel and dry, and then take the towel and turn the faucet off. You should always wash your hands before, during, and after preparing food, before eating food, before and after caring for someone who is sick, before and after treating a cut or a wound, definitely after using the toilet, after changing diapers or cleaning up a child who has used the toilet. You want to clean your hands after you blow your nose, cough, or sneeze in your hands. After touching an animal or animal feed or animal waste. After handling pet food or pet treats. And definitely after touching garbage. And so I would advise all of you to go out, check your local Gallia County or your local county health department, and get the Hep A vaccination, and then in 6 months get a booster. And so that's all I have today. I am hopeful that as we go into next week, that if you as a student are feeling quite stressed, that you definitely seek out your resources and utilize the information that I have talked with you about. You want to manage that stress and you know, be a fighter. Hopefully no one is suffering from major chronic stress, But if you are, please seek out help, and we do have free counseling here available at the University of Rio Grande. So all you will need to do is just come up to Health Services or Student Services and make an appointment with the counselor. So I wish you the best of luck coming up here next week, and my door is always open if you need to come in and talk about anything. But it soon will be over, and then you can move ahead. And so I wish you all the best of luck in the future here and through your endeavors next week. Thank you very much. Okay.